Hello and welcome to the overview of the Mindfulness Masterclass. Please review the terms and conditions of use displayed on a post in the community section of this channel. By continuing to watch this video, you consent that you have read and understand the terms and conditions. This video series is a component of the broader therapy program and the health and wellness program, Strengthening Your Conscious Self. Congratulations on taking these first steps towards cultivating a deeper understanding and practice of mindfulness. Over the course of this masterclass, we'll be exploring a wide range of concepts, practices, and philosophies that will enrich your mindfulness practice and hopefully transform how you engage with the world around you. This masterclass will be divided into 6 separate videos, each focusing on different aspects of mindfulness and its application in daily life. Before we dive into the specifics, let me give you an overview of what you can expect from this course and how it is structured. This Mindfulness Masterclass will consist of this overview video and the 6 course videos, and the following content materials: a batch of online activities, lessons, and exercises, and an assortment of PDF handouts, lessons, and worksheets that will be shared with you in the client account portal library on Therapy Notes. The most important of these PDFs are the class overview and class content outline. A client handbook will be available in the near future if it is not already available. During the progression of this class, you will be asked to watch other videos separate from the 7 core videos. They are videos from other content creators, including TED Talks, guided meditations, guided mind-body movement lesson videos, mindfulness skills lessons, and other educational videos. You will be invited to read academic and scientific journal articles, online magazine articles, and books on mindfulness and related mindfulness-based therapy approaches. You will be invited to complete these other optional assignments in the 6 core Mindfulness Masterclass videos. I also strongly encourage you to keep a journal just for notes, questions, and concerns for me, your clinician. You will be prompted in the videos with opportunities to reflect and journal your thoughts. Journal prompts will also be presented in the client handbook when the handbook becomes available. Let's discuss the course structure of 6 video sessions. The masterclass is thoughtfully designed to build your knowledge and practice progressively. Here's a breakdown of how the class is divided. In Session 1, you will learn about the importance of mindfulness. We will explore the history of ancient traditions, the rise of modern mindfulness, the many aspects and attitudes of mindfulness, the foundational pillars of mindfulness, and what mindfulness is and is not. We'll explore why mindfulness is a critical skill in today's fast-paced world, looking at its impact on mental, emotional, and physical well-being. In Session 2, you will learn about the benefits of mindfulness. We'll delve into the various benefits of mindfulness, from stress reduction to improved focus, emotional regulation, and overall life satisfaction. In Session 3, you will learn about the neuroscience of mindfulness. This session will cover the latest research on neuroplasticity and how mindfulness affects the brain, including changes in brain structure, activity, and executive functioning. In Session 4, you will learn many types of meditation as a tool for enhancing mindfulness. We'll explore different meditation practices designed to cultivate mindfulness, with guided examples to help you begin or deepen your practice. We'll learn about the Dialectical Behavior Therapy Mindfulness Skills Training course. We'll explore the idea of wise mind and review the what skills of observe, describe, and participate. We'll explore how to practice mindfulness and the how skills, non-judgmental stance, one mindful approach, and effectiveness or mastery in all the areas of your daily life. In Session 5, you will begin applying mindfulness in daily life. This session will focus on practical strategies for integrating mindfulness into your everyday activities, making mindfulness a natural part of your routine. You will be asked and encouraged to keep a journal, which can be a book or electronic. In the final video, session 6, you will learn about the integration of mind-body practices. We'll look at how mindfulness integrates with other mind-body practices such as yoga, tai chi, and qigong to create a holistic approach to well-being. You will learn about the integration of mind-body approaches to therapy. We'll look at how mindfulness integrates with other mind-body approaches such as polyvagal theory and vagus nerve stimulation, somatic experiencing, and sensory motor psychotherapy. Now let's talk about the learning objectives of this masterclass and what you will have gained by the end of the course. Objective 1. You will understand the importance of mindfulness and why it is a powerful tool for enhancing mental and physical health. Objective 2. You'll recognize the wide range of benefits that regular mindfulness practice can bring to your life. Objective 3. You will have gained valuable insights into the neuroscience underlying mindfulness, learning how these practices can reshape your brain and improve your overall functioning. Objective 4. You will have begun developing a personal meditation practice aimed at strengthening your mindfulness skills. Objective 5. You will have learned practical ways to apply mindfulness in various aspects of your daily life, from work and recreation to relationships. Objective 6. You will have explored how mindfulness is integrated into different therapeutic approaches and mind-body practices, allowing you to tailor your practice to your unique needs. Objective 7. You will have begun to develop the ability to observe, regulate emotions, and manage emotional responses through mindfulness and emotional intelligence, leading to increased resilience. Objective 8. You will have learned ways you can enhance your motivation, focus, attention, and discipline. Objective 9. You will have learned techniques to improve concentration and sustain attention, reducing the impact of distractions and enhancing your productivity. Objective 10. You will have learned how to increase your awareness of thoughts, feelings, and bodily sensations, allowing for greater insight into personal patterns and behaviors. Objective 11. You will have begun to practice non-judgmental self-reflection, promoting a kinder and more compassionate relationship with oneself. Objective 12. You will have begun to apply mindfulness techniques in professional settings, if applicable, to improve decision-making, communication, and leadership skills. Objective 13. You will have begun to strengthen your interpersonal relationships and use mindfulness to enhance communication, empathy, and understanding in relationships, leading to more meaningful connections. Objective 14. You will have begun to develop increased resilience by practicing mindfulness techniques that help manage and reduce the physiological and psychological impact of stress. 15. You will be able to apply a formal and informal mindfulness practice in between sessions and keep track of your practice. 16. For professionals, you will have learned how to incorporate mindfulness-based interventions into therapeutic practices to support clients' mental health and well-being. 17. You will understand how mindfulness can be used safely and effectively in the context of trauma, particularly through approaches like somatic experiencing and polyvagal theory. 18. You will have tailored mindfulness practices to fit your unique and individual needs and preferences, creating a personalized approach to mindfulness that resonates with your lifestyle and goals. 19. You will have enhanced the connection between mind and body through practices like yoga, tai chi, and qigong, integrating these into a holistic mindfulness practice. 20. You will have gained valuable insight into how mindfulness affects executive functions and cognitive processes, such as critical thinking, memory recall, memory consolidation, problem solving, planning, initiative, decision making, discipline, curiosity, and creativity, and how mindfulness and meditation practices support physical, cognitive, social, and emotional health and wellness. 21. You will be able to use mindfulness as a tool for fostering long-term positive behavioral change, particularly in areas like health, wellness, professional development, and personal growth. 22. You will have explored how mindfulness can unlock creativity and foster innovative thinking, both in personal and professional contexts. 23. You will be able to apply mindfulness to manage the stress and emotional impact of socio-political, religious, and ideological challenges, fostering resilience in the face of external cultural and political pressures. 24. You will be able to use mindfulness practices to clarify and align decisions and actions with personal values and beliefs, enhancing life satisfaction, meaning, and purpose. 25. You will understand the ethical implications of mindfulness practices and how a practice contributes to moral and ethical behavior and character strength development. 26. You will have learned how mindfulness can support physical health by reducing stress-related illnesses, improving sleep, and encouraging healthy lifestyle choices. 27. You will have begun to develop strategies to sustain a regular mindfulness practice over time, integrating it seamlessly into daily life. And lastly, 28. By the end of the course, you will have explored the spiritual dimensions of mindfulness, connecting it with faith practices like Buddhism, Taoism, meditation, prayer, and other contemplative traditions like Christianity, Judaism, and Islam. That concludes the learning objectives section of this video. This Mindfulness Masterclass is the first intervention I recommend to my clients. The skills and knowledge gained from this course will serve as the foundation of your therapy journey, laying the base for all the other therapy approaches I utilize, including MET, Motivational Enhancement Therapy, IFS, Internal Family Systems, DBT, Dialectical Behavior Therapy, CBT, Cognitive Behavioral Therapy, EFT, Emotion-Focused Therapy, MBSR, Mindfulness-Based Stress Reduction, MBCT, Mindfulness-Based Cognitive Therapy, and ACT, Acceptance and Commitment Therapy. In the next part of this overview, we're going to look at the integrated philosophies and modalities in depth. What sets this masterclass apart is the integration of principles and practices from a variety of mindfulness approaches and therapeutic modalities. Throughout the course, we will draw from many approaches. Let's take a brief look at some of them. The first approach we will review is mindfulness-based stress reduction, MBSR, developed by John Kabat-Zinn in the late 1970s at the University of Massachusetts Medical School. MBSR combines mindfulness meditation with body awareness to help individuals manage stress, pain, and illness. The program typically lasts 8 weeks and includes guided meditation, gentle yoga, and group discussions. MBSR is widely used in healthcare settings and is supported by extensive research demonstrating its effectiveness in reducing stress, anxiety, and depression. The next theory we will review are the attitudes of mindfulness. Kabat-Zinn emphasizes 9 attitudes essential for mindfulness practice. They include non-judging, patience, beginner's mind, trust, generosity, non-striving, acceptance, gratitude, and letting go. The attitudes form a solid foundation of mindfulness practice, guiding how individuals relate to their experiences and cultivate a mindful life. Another perspective we will explore are Dan Siegel's principles of mindfulness. Dan Siegel, a clinical professor of psychiatry, developed the concept of interpersonal neurobiology, which integrates various scientific disciplines to understand how the mind, brain, and relationships shape each other. Siegel's work highlights how mindfulness promotes neural integration, leading to greater mental health, emotional regulation, and resilience. His principles are often applied in therapeutic settings and personal development to enhance self-awareness and interpersonal relationships. Another approach to therapy we will review is mindfulness-based cognitive therapy, MBCT. Developed by Zindel Siegel, Mark Williams, and John Teasdale in the 1990s, MBCT combines traditional cognitive behavioral therapy techniques with mindfulness strategies to treat depression and prevent the relapse of depression, particularly in individuals with recurrent depression. MBCT is widely used as a therapeutic intervention to help individuals recognize and disengage from negative thought patterns. The next approach we will learn about in depth is dialectical behavior therapy and the DBT mindfulness skills training module. We'll discuss DBT's approach to mindfulness, particularly its focus on wise mind, radical acceptance, and living in the present moment. Developed by Marsha Linehan in the 1980s, mindfulness is the first module taught in DBT, which is a cognitive behavioral treatment originally designed for individuals with borderline personality disorder. DBT emphasizes mindfulness as one of its core skills, focusing on observing, describing, and participating in the present moment without judgment. DBT mindfulness skills are used in therapy to help clients manage intense emotions, tolerate frustration and distress, improve resilience to emotional vulnerability, and reduce impulsivity. We'll explore the concept of wise mind, the balance between emotion and reason, as a key aspect of mindfulness in DBT. Wise mind represents the integration of emotional mind and rational mind, where mindfulness is used to find balance and make decisions that are in line with one's true self. Next, we'll dive into the values and strengths-based approach, acceptance and commitment therapy, pronounced as ACT. We'll look at how ACT uses mindfulness to help individuals accept their experiences and commit to values-based living. ACT uses mindfulness to help individuals accept their thoughts and feelings rather than fighting or feeling guilty for them. It encourages commitment to action that aligns with one's values. ACT is applied in various therapeutic contexts to treat anxiety, depression, addiction, and other mental health issues. Up next in our Mindfulness Masterclass are the mind and body approaches, starting with polyvagal theory. We'll touch on how mindfulness practices can influence the autonomic nervous system, promoting safety and connection. Polyvagal theory, developed by Stephen Porges, explains how the autonomic nervous system influences emotional regulation, social connection, and fear responses. Mindfulness practices can engage the vagus nerve, promoting a state of calm and enhancing the body's capacity to recover from stress. Used in trauma therapy, polyvagal theory helps explain how mindfulness can support a sense of safety and connection, which is crucial for healing. The next mind-body approach we'll cover is somatic experiencing. This approach uses mindfulness to release trauma held in the body, aiding in healing and resilience. Developed by Peter Levine, somatic experiencing is a body-focused therapy that aims to relieve trauma-related stress by allowing individuals to process and release the bodily sensations associated with traumatic memories. Mindfulness is used in somatic experiencing to increase body awareness and help individuals stay present during the processing of trauma. This approach is used to treat trauma, PTSD, and related disorders by focusing on the physical sensations that arise during therapy. We will learn about internal family systems, IFS. We'll see how mindfulness is used in IFS to help individuals connect with and heal different parts of their psyche. Developed by Richard Schwartz in the 1980s. IFS views the mind as composed of multiple parts, each with its own perspectives and desires. Mindfulness is used to help individuals observe these parts with curiosity and compassion, leading to healing and self-leadership. IFS is applied in therapy to address a wide range of psychological issues, helping clients integrate and harmonize their internal parts. We will review mind-body practices like yoga, tai chi, qigong, and reiki. These ancient practices emphasize the integration of mind, body, and spirit through movement, breath, and energy work. Mindfulness is inherent in these practices as they require focused attention on the body, breath, and energy flow, promoting a deep sense of presence and well-being. These practices are widely used to enhance physical health, reduce stress, and cultivate a sense of inner peace and balance. We will learn about sensory motor psychotherapy developed by Pat Ogden. Sensory motor psychotherapy combines mindfulness with somatic therapies to address the physical manifestations of trauma. It emphasizes body awareness and movement to help clients process and release traumatic experiences. This approach is particularly effective for individuals with trauma-related disorders, as it integrates mindfulness into the therapeutic process to promote healing at both psychological and physical levels. We will also cover additional theories regarding mindfulness and meditation that are more subtly integrated into the masterclass. We will review the default mode network in mindfulness. The DMN is a network of brain regions that is active when the mind is at rest and engaged in self-referential thoughts, such as daydreaming or ruminating. Mindfulness meditation has been shown to reduce DMN activity, leading to a decrease in mind wandering and an increase in present moment awareness. Understanding the role of the DMN in mind wandering helps explain the cognitive benefits of mindfulness, such as improved focus and reduced anxiety. We will review the relaxation response. Coined by Dr. Herbert Benson, the relaxation response is the body's counterbalance to the stress response, activated by practices such as meditation, deep breathing, and mindfulness. The relaxation response is a key concept in understanding how mindfulness reduces stress and promotes healing by activating the parasympathetic nervous system. We will review neuroplasticity and mindfulness. Neuroplasticity refers to the brain's ability to reorganize itself by forming new neural connections. Mindfulness and meditation practices have been shown to enhance neuroplasticity, particularly in areas related to attention, emotional regulation, and self-awareness. This concept supports the idea that regular mindfulness practice can lead to lasting changes in the brain, improving overall mental health and well-being. We will review flow state theory. Flow is a state of complete absorption in an activity where one loses track of time and self-consciousness. Mindfulness shares similarities with flow as both involve focused attention and present moment engagement. Flow theory can be integrated into mindfulness practices to enhance productivity, creativity, and enjoyment in various activities. We will review the connection between positive psychology and mindfulness. Positive psychology, founded by Martin Seligman, focuses on the study of well-being and happiness. Mindfulness is considered a key practice in positive psychology as it contributes to life satisfaction, gratitude, and overall happiness. Mindfulness can be used to cultivate positive emotions and resilience, enhancing overall life satisfaction and well-being. You will learn how to practice loving-kindness meditation, metta bhavana. Loving-kindness meditation is a practice that involves focusing on feelings of love and compassion toward oneself and others. This form of meditation is closely linked to mindfulness, as it encourages present moment awareness and emotional openness. Loving-kindness meditation can be used to enhance empathy, reduce negative emotions, and promote emotional healing. We will review Transcendental Meditation, TM. TM is a specific form of silent mantra meditation that aims to transcend ordinary thinking and access a deep state of restful awareness. While not traditionally linked to mindfulness, TM shares the goal of enhancing mental clarity and reducing stress. TM is often practiced to achieve deep relaxation, reduce stress, and enhance overall cognitive functioning. You will learn how to engage effectively in mindful eating. Mindful eating involves paying full attention to the experience of eating, including the taste, smell, texture, and appearance of food, as well as one's bodily sensations and emotional responses. Mindful eating is used to cultivate a healthier relationship with food, reduce overeating, may lower your risk of certain diseases, and enhance enjoyment and satisfaction from meals. We will review Compassion-Focused Therapy, CFT. Developed by Paul Gilbert, CFT integrates mindfulness with techniques designed to foster self-compassion and reduce shame and self-criticism. CFT is particularly useful for individuals struggling with high levels of self-criticism, helping them develop a more compassionate and kind relationship with themselves. We will review the relation between self-determination theory, SDT, and mindfulness. SDT is a theory of motivation that emphasizes the importance of autonomy, competence, and relatedness in fostering well-being. Mindfulness practices can enhance these aspects by promoting self-awareness, self-regulation, and meaningful connections with others. Mindfulness can be integrated into SDT to support intrinsic motivation and personal growth. These integrated sciences, philosophies, and additional theories provide knowledge for a mindfulness practice, offering my clients a comprehensive understanding of mindfulness and meditation across various contexts and disciplines. This brings us to the conclusion of this overview. By the end of this masterclass, you will have a comprehensive toolkit for practicing and applying mindfulness in your life. Whether you are new to mindfulness or looking to deepen your practice, this course is designed to meet you where you are and guide you toward greater self-awareness, peace, and resilience. Thank you for joining this journey with us. I look forward to seeing you in the first session, where we will begin our exploration with the importance of mindfulness. See you soon.